from like a theory perspective, when people haven't, there's no hope or they've tried everything, or they've run out of options. The questions I always want to ask back, and they're actually the same questions we're going to put your treatment plan through. But if a patient said to me, I've tried everything, my questions back would be like, what specifically did you try to make sure that there wasn't something that was missed, an option, a solution? How long did you try it? Right? How long did you try it? And especially when we're talking about something like behavior change, it's not just like how long did you try it, but at what compliance level did you, like out of 10, what level out of 10 were you able to execute on it every day, week, month, or whatever the like appropriate cadence would be for them to achieve the benefit? So how long did you do it? And how, I'm going to say well, I don't mean that judgmentally. I just mean how well did you do it? Um, and what were you hoping the treatment would do? So you can see here that we're like getting to the bottom of like three massive miscommunications in medicine. Did you try everything? Like sometimes there are options that were not presented to a patient. That's fair. That does happen. Sometimes that's insurance related. Sometimes there can be a bias in your practitioner. Absolutely. Um, sometimes there is a stepwise process to get to a solution. So solution A is tried. If it fails, solution B would be the next thing. But if patients never went back to the doctor and said that it didn't work, they don't know that there's another step, there's another solution. So that's really important. Like, have we looked at all the options and why did we choose this one and not this one? And is there any room for just choice, right? Another choice. Also, how long did you do it? So aside from like an Advil, there's not very many medications that work when you take them once. And asking your patient how long they took it for and what their compliance level was with the thing, again, especially as we start to talk about behavior change or exercise or what have you, how long you did it for will dramatically change whether or not you get the result we were hoping to get. Most medications, most supplements, and I'm jumping ahead here, most supplements are a 12-week randomized control trial. And sometimes in that 12 weeks, we're only seeing partial results and we don't see full results until 6 months. So asking them how long they did the treatment makes a huge difference for our understanding and at what compliance level. So how many pills a week did you miss? And I would usually ask it in that way because it's already giving them permission to have missed some doses, right? How many days a week did you miss? And then they'll say, well, like max maybe one or two, right? If you say, did you miss any doses? They're going to go, no. So always ask the question. It's like a positive psychology thing. You just always say, how many did you miss? And that because we know you missed some. So just be real about it. So how long did they do the treatment and at what level did they do it? And then this last piece, which is very important, is what outcome were you hoping to achieve that you didn't achieve? And the reason we ask this is because sometimes the patient is looking for an outcome that the drug didn't target. Sometimes the patient is looking for an outcome that takes longer to achieve than some other aspects of the treatment. Sometimes they are looking for like a third secret way. They're hoping the medication helped, but had never mentioned to anyone. And so now their expectations actually are, I'm going to say, unreasonable in air quotes, because they're looking for something that was never going to happen. And this is very common. And it's a miscommunication. It's not, your patient is not intentionally having unrealistic expectations. There's a miscommunication. They never happened to mention that they were really hoping for XYZ with this treatment, right? They're maybe getting treated for something that's related to, say, their period cramps, but it has no impact on flow. And now they're upset that the flow is no better. And so they see themselves as being incurable, but nobody was trying to treat the flow of their menstrual cycle, right? Like, this is why it's so important that we have like ultimate clarity on what is the actual measurable outcome we're trying to achieve.